Toke, and I'll be your nurse today, and I'm just going to be doing an indwelling catheter, and I just want to make sure that you are Mary, so I'm just going to check your armband and your name. Okay, so I'm going to be putting an indwelling catheter in you just so that you're able to use the bathroom. It'll only take a couple minutes, 5 to 10 minutes, and you should not feel any pain. I'm going to palpate for any distension or any discomfort. Okay, so I have my supplies. Since it's unpackaged, if it was packaged, I'll demonstrate proper, sterile unpackaging of all. There's no hand sanitizer, but I'm performing hand hygiene. And I'm going to pull down the covers and then drape the patient, if I have one, for privacy. And make sure there's a waterproof pad underneath. So I'm gonna have them spread their legs out on their back in a dorsal recumbent position. Now she's in a dorsal recumbent position, and she's gonna be lying on her back with her knees flexed. I'll now perform perineal care to my patient, but first I will apply gloves. With a clean cloth, I'm going to clean the labia and the urinary meatus. From the clitoris to the anus, so you go from the side to the other side, and then so I now have the catheter tray. I'm going to keep it on a clean surface, so I'm going to put it on the patient's bedside tray, or if possible I could put it right between her legs, but for today we're going to put it here. I'm now opening the package. So I'm now going to open up the package in a sterile way so I don't make this non-sterile, and I'll use the 1-inch borders along the sides. So you open it away from you, then to the side, to the other side, and then down below. Now I'm going to grab this square drape and I'm going to let it unfold without letting it touch anything unsterile. Gonna make a fold, and I'm going to put this shiny side down underneath the patient. I'm going to put on the sterile gloves. Sterile drape that I'm gonna put over you. I don't even know how I open this thing. How the frick is she? So we have the pre-filled syringe, and this will inflate the balloon. 4 cotton pads, forceps, lubricating jelly, cleaning solution, as well as a cup to collect the sterile tray. So I'm going to take the sterile solution and I'm going to pour it into the cotton pads. And really saturate them. So if I had the package, I would make her open it sterilely. I'd peel it down, wrap my finger around it, and slowly remove the pack. I'd take it and I would put this on the sterile field. Now I will dip the end in the lubricating jelly, twirl it around, and now once the iodine is in the cotton pads, I'm going to cleanse the urethral meatus. So I'll take the saturated cotton balls and I would wring them out. And I'll take one and I will spread apart the labia, and I'll clean one side, clean the other side, and then down the middle. So I have now picked up the catheter 7.5 to 10 centimeters away from the tip, and I will be now insert it into the urethral meatus. When the urine appears, I'm going to advance it another 1 to 2 inches. I'm going to hold the urethra with my non-dominant hand, and I'm going to use the syringe to inflate the balloon. The full amount, I'm going to pull on the catheter until I feel resistance. Okay, so here I've already attached the catheter bag to the drainage bag. So now I'm going to remove my gloves and apply on clean gloves. So I now have applied new gloves, and we're going to make sure that it is attached to the urinary bag, and I'll also attach a device on here to prevent it from touching. Now to remove the catheter, you have to uninflate the balloon. So you put the syringe back in, and you just slowly draw out the water. And make sure you have all deflated the balloon. We're going to take this syringe out and then remove the catheter. I'm going to discard, so once I deflated the balloon, I'm going to discard the catheter, and I'm going to wrap it up to make sure there's no excess fluid coming out of the tube. To get rid of the full catheter bag, you have to coil it, and then you'll take it off from the side of the bed, and then washing would be more appropriate than sanitizing, because sanitizing doesn't always get everything off. So when you hand wash, you have a better chance of cleaning up all the bacteria, and it's more effective than just using the regular sanitizing method.